Hi, and here we are. We're going to be talking now in week 4 about theoretical perspectives about the anxiety disorders. Now, it's important just to note that we're looking at different theories. So it's not unlike wearing sunglasses and looking outdoors and then changing your sunglasses from one color to another color and looking outside. And as much as you're seeing the same outdoors, the sunglasses give you a different perspective on the outdoors based on the color shade difference. And if you did it through different glasses, you would view that world in a different view because of the color. So treat the theories as being a way to explain where or how anxiety or OCD or post-traumatic stress disorder, where it comes from, and how might they explain the source of where it comes from or why it is. And there's no absolute right way. And in fact, in many cases, as we'll see in video 2 in this week, looking at treatments, how the theory connects to treatments and how really there isn't any absolute one-size-fits-all. Sometimes there are combinations. So this particular video, we're going to look at the theories, and then the next video we look at in week 4 here will be on treatments. Let's get at it. We'll start with the psychodynamic perspective. The psychodynamic theorists view anxiety disorders as attempts by the ego to control the conscious emergence of threatening impulses. Feelings of anxiety are warning signals that threatened impulses are nearing awareness. The ego immobilizes defense mechanisms to divert the impulses, thus leading to different anxiety disorders. Now, phobic objects symbolize aspects of unconscious conflicts, for example. Now, the ego immobilizes defense mechanisms to divert the impulses, thus leading to different anxiety disorders. So, for example, you'll see a long list here, and these are also in your textbook. Projection, displacement. As an example, if you see in your textbook the little Hans story that's in your text around Freud's time. Now, essentially, the psychodynamic theory considers the unconscious conflict as largely speculative, as we can't test what the unconscious knows or experiences, at least not yet. And so this is a perspective that's hard to prove based on its own information that we're not, one, conscious of, and two, well, then how do you test what we're not conscious of? However, it's been a long-standing theory and a theoretical perspective, and that's how they view things. Now, the next one we're going to look at is the the behavioral learning perspective. And the learning theorist explains anxieties through conditioning and observational learning. Mauer's two-factor model incorporates both classical, which is Pavlov's associations, and operant conditioning, which is relief from anxiety by reinforced avoidance, in a way of explaining phobias. Now, the principle of reinforcement may help to explain patterns of obsessive-compulsive behaviors based on whatever obsessive thoughts or compulsive behaviors that are occurring. There is a reinforcement schedule for those to increase. Remember, one of the key elements about reinforcement is it doesn't matter whether or not it looks reinforcing. If it increases the behavior, then there's a reinforcement at play. Now, there is an element of what's called prepared conditioning, and this is an evolutionary feature. This is where there's a tendency towards fear of spiders over bunnies because spiders are higher on the threatening scale. Now, phobias, however, appear to be moderated by cognitive factors such as self-efficacy experiences. And this is the feeling and the ability to think that you can do things and having a positive view of your capabilities. The principle of reinforcement may help to explain patterns of obsessive-compulsive behavior. People may be genetically predisposed to acquire certain types of phobias that may have had survival value in prehistoric ancestors. Cognitive factors may also have a role in anxiety disorders, such as, the over-prediction of fear, irrational beliefs, self-efficacy expectations, self-defeating thoughts, and other sorts of attributions for panic attacks. Now, if we move into the cognitive approach, we can see that the focus on how dysfunctional patterns of thinking may set the stage for anxiety disorder. Self-defeating thoughts can heighten and perpetuate anxiety disorder. Irrational beliefs may involve exaggerated need to be approved by other people, and to meet the situation in which negative appraisals from others might arise. Oversensitivity to a threat. Most of us respond to threats rather adaptively. That is to say, we respond to them in a way that's appropriate for the level of threat that occurs. Whereas others, their alarm mechanisms cause them to be overly responsive. Another issue relative to the cognitive approach is what's called anxiety sensitivity, or other words saying, a fear of fear, that one's emotions or state of arousal will get out of control or have some sort of harmful consequence on themselves or others. When we look at the model that I have here, the model above, it suggests that people are prone to panic disorders, view certain bodily cues, maybe you start to have a little palpitation in your heart, or sweating, or that sort of butterfly experience in your stomach, or any of these sort of external stimuli as threatening or dangerous, and either through learning, historically, if they've always responded in this sort of manner and learn, or through an oversensitivity to these experiences, these internal bodily cues or external environmental things, that these perceived threats are met with apprehension. And so, just to make a point, the cues, either internal or out there, normally are handled and experienced. Doesn't mean they aren't in some capacity difficult, or in some capacity sort of feeling like it's a problem. But the difference is that for someone who's prone to panic attacks, is they appear and feel much more exaggerated, a greater threat, which then is linked to apprehension. And that apprehension, which affects the intensity of these bodily sensations. There's an increase in heart rate, there's rapid breathing, and other such internal cues. This leads to a misinterpretation of the original signs of panic, or even worse, catastrophe, which are further reinforced, and reinforces the perceived threat as difficult, as worthy of the panic. And so this cycle continues to repeat. It's part of the reason that there's an explanation that cognitive factors appear to play a very key role in the development and maintenance of anxiety and panic attacks, what we say to ourselves and what things we repeat inside our head. It also then would suggest that some of the solutions to treatments might also be found in a cognitive approach. So if we look at the biological perspective, seeks an explanation of anxiety disorder that's based on studies of genetic factors, neurotransmitters, and the induction of panic by biological means. Genetically, twin studies have been very helpful. The higher agreement rate with monozygotic or MZ twins over that of dizygotic or DZ twins. The relation between genetic vulnerability and the environment are being explored on how one affects the other. And the value, as you can see, around why MZ or monozygotic twins, identical twins, are important is that they have 100% of the same shared genes, whereas dizygotic twins have the same amount of distribution or difference, if you will, between them as do siblings who were born apart. And so by seeing what monozygotic twins, how much they share, if anxiety is shared in both, then it shows a strong genetic component, whereas if you have dizygotic twins, you might see that distribution between the two. Now, what's really important in terms of the genetics is also looking at neurotransmitters. And the neurotransmitter gamma aminobutyric acid, or GABA, it's an inhibitor transmitter. It helps tone down excessive nervous system from being overly excited. But when it's not performing adequately, neurons can fire excessively. And this connects to our sense of anxiety. So if this transmitter isn't doing its job well enough, it can put some people prone to more anxious results. The biological aspects of panic disorder, well, because of the physical components of panic disorder, it's thought that there may be some biological underpinnings. It's supported by the fact that some people, particularly those with PD, panic disorder, then to have a biological response, this infusion or manipulation of CO2, which produces hyperventilation. The manipulation of CO2 levels in a combination of genetics and early childhood experiences, and along with cognitive factors, may have strong influences. Now, this is where we see that perspectives might share different views with one another to explain some of the psychological disorders. Biological aspects of obsessive compulsive disorder that might involve the disruption of the neural network in the brain that signals danger. Increased signaling needs immediate attention. Compulsive thoughts and repetitive behavior feel like being stuck in gear. Now, not all people who experience traumatic events develop related phobias or anxieties. Some people may inherit a genetic disposition. Now, if you remember from chapter 1, this is diathys, the diathys model. That makes them respond with greater negative arousal, or makes them more likely to panic in response to changes in bodily sensations. Now, whether anxiety gets out of control may depend on other vulnerability factors like anxiety sensitivity. So this is just a quick overview of some of the theoretical perspectives that might help us understand at least anxiety and obsessive compulsive disorder as it relates to abnormal psychology. So please go through your textbook, make some highlight notes on what you thought was important and how you think it will help you with your test that's coming up, all right? Good luck, everybody, and pay attention to video 3.